If you've been diagnosed with the nasal polyps, you might assume they're caused by allergies. While allergies can contribute to their development, nasal polyps are not always allergy related. These benign growths in the nasal passages can result from a variety of conditions, many of which involve chronic inflammation. Let's explore the possible causes and when you should seek further evaluation. What are nasal polyps? Nasal polyps are soft, painless, non-cancerous growths that develop inside the sinuses and nasal passages. They can block airflow, causing chronic congestion, lead to frequent sinus infections, reduce or completely eliminate your sense of smell, and cause postnasal drip, facial pressure, and snoring. Are allergies always to blame? No! While allergic rhinitis or hay fever can contribute to nasal inflammation, many people with nasal polyps do not have allergies. If allergy treatment isn't helping, another cause may be at play. What else can cause nasal polyps? Several non-allergic conditions can lead to chronic nasal inflammation and polyp formation, including chronic sinusitis with or without allergies, long-term sinus inflammation lasting 12 weeks or more increases the risk of polyp development. They may be linked to bacterial or fungal infections. Aspirin-exacerbated respiratory disease, AERD or Samter's triad, a condition involving asthma, nasal polyps, and aspirin NSAID sensitivity, triggers severe nasal congestion and sinus inflammation after taking aspirin or ibuprofen. Non-allergic rhinitis or inflammation of the nasal passages without an allergic trigger is often caused by irritants like pollution, strong odors, or temperature changes. Cystic fibrosis, a genetic condition that leads to thick mucose buildup in the lungs and sinuses. Nearly 50% of people with cystic fibrosis will develop nasal polyps. Fungal sinusitis, which is chronic sinus inflammation due to fungal overgrowth of the sinuses. It is more common in people with weakened immune systems. Immune system disorders, conditions like Churg-Strauss syndrome or eosinophilic granulomatosis with polyangiitis, EGPA, can cause polyps due to excess inflammation and eosinophilic activity. How are nasal polyps diagnosed? If you have persistent nasal congestion and breathing difficulties, your doctor may recommend nasal endoscopy, a small camera inserted into the nose to examine polyps. CT scan of the sinuses provides a detailed image of polyp size and location. Allergy testing to determine if allergies are contributing to inflammation. Genetic testing if cystic fibrosis is suspected in children or young adults. Treatment options for nasal polyps: nasal steroid sprays to shrink the polyps, oral steroids for severe inflammation, only for short-term use, biologic medications like Dupixent for polyp-related inflammation, sinus surgery, endoscopic polypectomy for large or obstructive polyps, aspirin desensitization if AERD is the cause, saline rinses to flush irritants and improve sinus drainage. Facts: nasal polyps and causes. Can nasal polyps go away on their own? Small polyps may shrink with medication, but larger ones often require medical treatment or surgery. Are nasal polyps cancerous? No. Nasal polyps are benign. However, persistent sinus symptoms should always be evaluated. If I don't have allergies, how can I prevent nasal polyps? Managing inflammation is key. Use nasal steroids for the sinuses and avoid irritants like smoke and pollution. If you have persistent congestion or frequent sinus infections, nasal polyps could be the culprit, even if you don't have allergies. A specialist can help identify the cause and find the right treatment plan for you. What are you waiting for? If you or your child need help controlling allergies, or if you think you might need testing or treatment, or you might be a good candidate for allergy shots, Dr. Wendt and her team staff at Relieve Allergy, Asthma, and Hives would love to help. Call for testing or treatment today, 480-500-1902, or request an appointment at relieveallergyaz.com. Learn more about Dr. Wendt and relieveallergyaz.com. Or connect with us on Facebook, LinkedIn, X, Instagram, or YouTube. Did you know Dr. Wendt wrote the book on allergies? Buy it now on Amazon. Relieve Allergy, Asthma, and Hives is at 21803 North Scottsdale Road, Suite 200, and has convenient evening and morning hours and telemedicine appointments to accommodate your schedule.